Hey everybody, my name's Chris and welcome to the Stress-Free NP. This channel is dedicated to skills no matter what your title is. We're going to take you step by step and create a systemic approach to help you and your practice become stress-free. Always remember to like and subscribe so you don't miss any weekly video updates, and let's get started. Hey guys, welcome back to part 2 of why phlebotomy is so hard. So now we went over all the equipment, the anatomy, the tubes, the tests, everything in part 1. Now we're going to put it all together and we're going to go over the procedure. The first thing when you're drawing blood is you need to get your equipment. So the equipment that you need, you're going to need your butterfly, you're going to need your vacutainer, your tubes, the color tubes depending on the test that you've drawn. And we went over the test in the first video. You need a tourniquet, you need an alcohol pad or a chlorhexidine swab, you need tape, gauze, and a pair of gloves. So now that we gathered our equipment and we go to the bedside or the patient side in a doctor's office or a lab, we want to make sure all our equipment is accessible. This is a one-handed procedure and you don't want to be fumbling when you have a needle in somebody's arm. So we're going to start the procedure by learning how to tie a tourniquet. This is a standard tourniquet. It comes in all different shapes and colors. This one's white, it comes in blue, it comes in yellow. It just depends what your facility provides. When you're tying a tourniquet, the first thing you want to do is you want to determine where you're going to put the tourniquet. In our first video, we spoke about placement of the tourniquet. If you're drawing from the antecubical area, you're going to want to place the tourniquet over the bicep. If you're drawing from the hand, you're going to want to place the tourniquet on the lower forearm area. This allows for blood to fill up into the veins, either here or in the hand, so they can plump up so you can stick them. So now let's go over the procedure of actually tying the tourniquet. Okay? Pretend this is our arm. You're going to put the tourniquet behind the arm. You're going to turn it over and crisscross just like this. When you crisscross, you're going to pull in one end. You want this loop here. You're going to have two ends and a loop. Now, if the tourniquet is still too loose, you can take the loop end and the other end right here that forms the crisscross, and you can pull and tighten as tight as you want, okay? When the procedure is over and the blood is drawn, we have this little tug right here. You could tug it, tourniquet comes right off. You don't want to tie a tourniquet like this, because then you can't take the tourniquet off with one hand. You're going to be fumbling, it's tight, it's uncomfortable for the patient. The safest way is to crisscross. Hold with one hand the crisscross, take one end, tuck it underneath, creating a loop. Take the loop and the end with the crisscross, pull and tighten. All right, one more time. Crisscross. Hold the cross with one hand. Take one end, loop it underneath. Take the crisscross end and the loop, pull and tighten. When you're done, take the other end and pull it right off. And that's how you tie a tourniquet. Now that we have our tourniquet tied, you want the patient to make a nice tight fist, okay? This is going to allow the blood to pool into the lower arm and the veins to fill up with blood so they can pop up and you can feel them. There are a few things you need to know about the vein before you can stick it, and let's get into it. First, you want to visualize. You want to know where you're going to stick first. Let's start with the AC. In the AC, if you remember our anatomy, we have our four veins. We have the basilic, the two antecubical, and the cephalic on the lateral end. Okay? The antecubical veins are usually well visualized. Sometimes they're not. In this case, I have pretty good veins, so you can visualize the vein coming here. The second part is you want to determine the direction. This is how you know where to put the needle. If the direction of the vein is diagonal and you stick straight up, you're going to stick right through the vein. So the direction of the vein is very important. The next part is the depth. Is the vein shallow or is the vein very deep? Now remember, we always stick shallow to deep regardless, but you want to know how far you're going to have to stick the needle into the arm before you get a blood return. The next part about it is bounce. Veins are very bouncy. If you take your pointer finger with the pad of your pointer finger, the most sensitive part of the finger, and you run it across the vein, you're going to feel a bounce. This is different if you're feeling a tendon. Sometimes it's difficult to determine whether it's a vein or a tendon. The quick trick to do while you're with the patient is have the patient bend their arm. A vein is not going to pop out when the arm's bent, but the tendon will. So if you're feeling the tendon right here, patient bends the arm, the tendon's going to rise up into the arm, right into the pad of your finger. Now you know it's a tendon and not a vein, and you definitely don't want to stick that. Another tip to determine if the vein is stickable is to roll your finger. Take your pointer finger over the vein and roll it. You're going to feel the contour of the vein, the roundness of the vein. You're going to feel the bounciness. This is really helpful when the vein is not well visualized and it's very deep in the arm. You can still feel it, you can still stick it, but you can't see it. By rolling your finger around the vein allows you to determine the contour, the direction, as well as the size of the vein. The size of the vein is going to determine the size of your needle. If you have a very large vein, like I do right here, you can use a larger needle, a 21 gauge butterfly. If you have a patient with very tiny veins and you feel it and the vein feels very small, you're going to want to use a smaller gauge needle to stick that vein. So now we tied our tourniquet, we found our vein, we know the direction, we know the depth, we know the size. We're very confident that we can stick this vein and get a successful blood draw. So now let's go through the procedure itself. We have all our equipment here. Like I said, you want your equipment right next to you so you can do it one-handed. We're going to use this as a demonstration. Obviously, there would be a tourniquet around here for the blood to pool in the veins to allow the veins to pop up. The first thing you're going to do is the site that you're going to stick, you're going to wipe clean. You can either use a chlorhexidine. This is a ChloraPrep. Sometimes they come in little packages like the alcohol. And remember, chlorhexidine does not have to be in concentric circles. You can scrub back and forth, left to right, doesn't matter. When you're using an alcohol pad, you do have to do in concentric circles starting from inside to outside. That's the proper way to use an alcohol pad. Now that you scrub the area is clean, you know where the vein is, pick the point where the vein is and where you're going to stick, and don't lose it with your eyes. The next part, you're going to take your butterfly needle. It's going to look like this. There's going to be a cap on it. The cap is to protect the needle. Only take the cap off when you're ready to stick. We take the cap off. At the tip of the needle, there's a bevel. You always want to stick with the bevel facing up. Never facing down, left, right, always up. The way that we hold a butterfly is we're going to take these two butterfly wings that they have, and we're going to move them up. We're going to take our middle finger and we're going to take our thumb and we're going to move it up like this, and we're going to hold the needle just like this. This is going to give us the best control that we can get when we're sticking the patient. Now, say the tourniquet is up here, the vein is right here where we want to stick. Your left hand or your non-dominant hand is going to hold the arm lower. You don't want to put the needle resting on your thumb and pivot up and down. You're not going to get the shallowest angle when sticking. You want your hand a little lower than the needle. That way the needle is perfectly parallel to the patient's skin. That way you can just stick under the skin. Right before you stick, you're going to want to use the thumb of your non-dominant hand, and you're going to want to pull down on the skin. This is going to anchor the vein. This is going to keep the vein in place. It's going to prevent it from rolling and give you the best success for making a proper needle stick. Once you have the vein anchored, you know where you're going to stick. You're going to take your needle right parallel to the skin, and you're going to stick shallow to deep. So shallow, shallow, shallow. If you see the flash of blood, you're going to see it in this chamber right here. Okay? The next thing you're going to do is you're never going to let go of the needle. You're going to let go of your left hand. You don't have to anchor the vein anymore once the needle is inside. You're going to take your vacutainer and you're going to take your tubes. This is why it's so important to have your equipment right next to you, because this is a one-handed procedure. One hand on the needle and the other hand feeding the tubes into the vacutainer. You're going to place the tube into the vacutainer, and the vacutainer has these two little wings on it. These two little wings allow you to put your pointer and your middle finger, and your thumb is going to push the tube right into it. You're going to hear a click. That means that the sheath on that needle inside the vacutainer is up. The needle is inside the tube, and every single tube has a vacuum in it, and it's going to suck the blood into the tube. There's nothing else that needs to be done. Once the tube is properly filled, you're going to do the same thing with the wings. Click it off. Take the tube. You're going to invert it 2 or 3 times. You want to mix the blood with the additive in the tube, and then you're going to place it to the side in an area where it's not going to roll. You're going to, just like that. You're going to take your next tube, same procedure, take your 2 fingers with the wings on the vacutainer, push up, you hear your click. Once the tube is filled properly, push up on it, take the tube, invert it 2 or 3 times, place it down in an area that's not going to roll. Once all your tubes are filled, you're going to take your gauze. I like to use a 2x2 just like this. You're going to roll it into a square. So you're going to roll it just like this, and now it's a perfect square. You're going to put it right on top of where the needle enters the skin. Okay, and you're going to pull your needle out, and you're going to hold pressure with your left hand. With your right hand, there's a button right on the butterfly needle. You're going to press it. The needle's going to retract into itself. This is the safety. This is going to prevent you from sticking yourself with a dirty needle. This can be placed to the side. You're going to hold pressure. If you're in a lab or something like that, usually holding pressure here, you can have the patient bend the arm. That way, this frees up both of your hands to take a piece of tape and tape the gauze onto the patient's arm. You want to tape it a little tight, keeping pressure with the ball of gauze. All right, this can stay on the patient for an hour or 2 until the puncture wound heals and stops bleeding. If the puncture wound continues to bleed, keep pressure on it, okay? The more pressure you keep for the longest amount of time, the more success you have at stopping the bleeding. You can have the patient raise their arm above your head. This is going to drain the arm of blood and allow all your platelets and clotting factors to come in and clot off the puncture wound. All bleeding will stop eventually. You're going to want to hold a little longer for patients who do take blood thinners, because it's going to take a little longer for them to clot. Always make sure 2 fingers holding pressure. Put your thumb on the back and squeeze. This is the best way to hold pressure. It's going to be a little uncomfortable for the patient. It's going to be tight. It might even be a little painful, but it's not going to last very long. It's just for the bleeding to stop. You don't want to take the original gauze off. When the gauze comes off, it's going to pull off the scab or the clot that is in that puncture wound, and then you're going to start bleeding again. You want to keep the gauze on. You can even place another piece of gauze on top and place another piece of tape over it. Okay, now that we're all done drawing blood, we need to label it, package it, and send it off to the lab. The first thing you want to do is you want to take your sharps. This is the butterfly needle in the vacutainer, and you want to put it in the sharps container. You don't want to throw this in the regular garbage. The second thing is properly labeling your tubes. If you're in a lab or a hospital setting, you're going to have patient labels that you can put on the tubes. If you're in a doctor's office, you might have to write the patient's name on the tube. You want to make sure it's legible, and you want to make sure that the date of birth is on the tube as well. Once the tubes are properly labeled, you can place them in your biohazard bag, seal it up. Most biohazard bags are going to have another compartment in the front like this. This is where your lab requisition goes. The lab requisition shows you the lab what tests you want for each tube. And that's it. Once you send your bloods off to the lab, you're done. You've made a successful blood draw, and it's that simple. Thank you guys so much for watching. Really appreciate it. If you liked the video, please like and subscribe so you don't miss any weekly video updates, and we'll see you next time.